There's an alarming outbreak causing concern among health officials in the United States, as norovirus has been spreading rapidly, and doctors say it is highly contagious. Commonly known as the stomach flu, it's a highly contagious virus now spreading across the U.S. Health officials said that in December 2023, there were 15 norovirus or norovirus-like outbreaks reported statewide. A year later, there were 70 such occurrences, a 350% increase year over year. It comes as states have been dealing with increases in flu, COVID, and RSV cases. But why norovirus has come on so strong, so fast, remains unclear. The Centers for Disease Control and Prevention says the illness can be extreme, with symptoms including diarrhea and vomiting. To help avoid catching the virus, they recommend proper hand washing, as well as keeping food, surfaces, and laundry clean. But there is one common thing that is not very effective. Conventionally formulated hand sanitizer is not very effective against norovirus, said a microbiology professor who wants to remind us that we had a global pandemic. We were shut down. That made it harder for norovirus to spread. Norovirus symptoms typically begin 12 to 48 hours after exposure to the virus, per the CDC. These are often sudden and explosive. Common norovirus symptoms include diarrhea, vomiting, abdominal pain or cramps, and nausea. People often vomit or have diarrhea many times, and these can happen simultaneously. Norovirus symptoms typically last 1 to 3 days, and most people will recover on their own completely. In most cases, norovirus is not life-threatening and deaths are rare, especially in the US. However, it can cause severe disease and complications. The concern is always dehydration because of the liquid loss through vomiting and diarrhea. The people at highest risk of severe illness include young children, older adults, and people who have compromised immune systems or underlying conditions such as diabetes or heart disease. Signs of dehydration include decreased urination, dry mouth, or dizziness. Children may cry without tears, have dry lips or sunken eyes, and become fussy or lethargic. How does norovirus spread? Well, norovirus spreads between people very easily. Once infected, a person can dispose and share billions of norovirus particles in their vomit and stool. It takes a very small number of norovirus particles to start an infection, and people get infected when these viruses get in their mouths. Transmission of norovirus can happen through direct contact with a sick person, sharing food or utensils with a sick person, consuming food or drinks contaminated with the virus, touching contaminated surfaces, then touching your mouth, inhaling aerosols from a sick person's vomit. Most outbreaks of norovirus happen when infected individuals spread the virus to other people through close contact, according to the CDC. Common settings for norovirus outbreaks include schools, daycares, cruise ships, nursing homes, and healthcare facilities. The virus particles can live for extended periods on surfaces such as doorknobs, toilet handles, sinks, and counters, which makes it easy to spread through indirect contact as well. Norovirus is also the leading cause of foodborne illness in the United States, per the CDC. It is a big issue that norovirus can contaminate many foods, especially foods that are not cooked. So be careful with raw shellfish, oysters, and clams, which can become contaminated when they filter feed polluted water, as NBC News previously reported. How long is norovirus contagious? Norovirus is contagious from when the symptoms begin until at least a few days after symptoms are gone. People infected with norovirus can carry the virus even after they recover. It's possible to spread norovirus to others for 2 weeks or more after you feel better, according to the CDC. Norovirus particles are very difficult to kill. Alcohol-based hand sanitizers or cleaners are not as effective against norovirus, which is why proper hand washing is key to prevent the spread. Norovirus treatment. Health professionals indicate that there is no specific treatment for norovirus. Norovirus usually gets resolved on its own, however. Rest and supportive care can help manage symptoms. Rehydration is the most important thing. Drinking water and sports drinks can help replenish fluids lost during diarrhea and vomiting. High-risk individuals or people with severe disease may require additional care, such as getting intravenous fluids. If norovirus symptoms become severe, persist, or worsen after a few days, or you can't keep fluids down, seek medical attention. How to prevent norovirus. There is no vaccine available at the moment for norovirus, so prevention is very important. You must take the following actions to protect yourself and others against norovirus, according to experts. Wash your hands often. Cook shellfish thoroughly. Stay home when sick. Avoid cooking for others while sick. Disinfect contaminated surfaces with a bleach solution. Launder soiled bedding or clothes on high heat.